Dr. Malathi, consultant in Nutrition and Dietetics at Rainbow Children's Hospital, Marathahalli. Today, our dietetics team as well as FNB team will be demonstrating some recipes suitable for complementary feeding. What is complementary feeding? It is introduction of some foods after 6 months of baby's age, because breastfeeding alone is not adequate to sustain growth. Some appropriate, adequate foods, which are also called as weaning foods, are required, and they have to be started, but breastfeeding to be continued as long as the mother can continue the breastfeeds. So these complementary foods to be preferably homemade, because these are easy to cook, economical and safe. So in today's video, we will be demonstrating some recipes like pureed apple, pureed carrot, cereal pulse mix porridges without milk, and then vegetable khichdi in a mashed form. So please do watch our video and then understand and practice those and write to us for any queries. Thank you.
First recipe is carrot puree. Take 100 grams of coarsely chopped raw carrots. Add 100 ml of water. Cook it thoroughly for the 2 minutes till it is cooked. Keep them aside for cooling. The final carrot puree weighs 150 grams. The nutritional significance of carrot: it contains polyphenols, carotenoids, acts as anti-inflammatory, immune enhancer, improves vision, vitamin A, minerals, calcium and phosphorus. It promotes digestion and enhances absorption. Recipe is apple puree. Method of preparation: take 100 ml of water in the container. Add 120 grams of peeled chopped raw apple into the container. And bring to boil for 2 minutes till it is cooked thoroughly. Keep them aside for cooling. The final apple puree weighs 110 grams. Nutritional significance of apple: it contains soluble fiber, polyphenols which act as antioxidant, anti-inflammatory and regulates immune response. Quercetin in apple helps to protect our brain against oxidative stress. Third recipe is cereal pulse porridge without milk. Take 200 ml of water in the container. Add 2 tablespoons of cereal pulse mix powder into the water. Cook the mixture on the low flame upon stirring till the consistency is thickened. Once the consistency is thickened, keep it aside for cooling. The weight of the final finished product is 100 grams, and transfer that to a bowl. Nutritional significance of cereal pulse mix porridge without milk: cereals are an excellent sources of carbohydrate, B group vitamins including folate, minerals like iron, magnesium, copper, phosphorus and zinc. Pulses are an excellent source of protein, fiber, iron, zinc, folate, magnesium. The fourth recipe is vegetable khichdi. Take 240 ml of water into the container. Add cleaned 30 grams of rice. Add 30 grams of cleaned dal. Add 30 grams of vegetables, carrot and beans. Keep cooking it for 15 minutes till it is thoroughly cooked. The weight of the final well-cooked khichdi is 250 grams. Ground the well-cooked khichdi in a mixer to get a fine mashed khichdi. Nutritional significance. Rice is an excellent source of magnesium, phosphorus, manganese, selenium, iron, folic acid, thiamine, and niacin. Moong dal is rich in potassium, iron, copper, folate, magnesium, fiber, vitamin B6. Vegetables are a good source of fiber and antioxidants. I am Dr. Namita Menon, Senior Clinical Dietitian at Rainbow Children's Hospital, Marathahalli. I'll explain the benefits of complementary feeding. It is associated with the food preferences and eating behavior. Finger foods helps in the hand-eye coordination. Introduction of fruits and vegetables will tackle the iron deficiency, anemia, and the cereals and pulses will tackle with the calcium deficiency also. In case you need more assistance regarding the weaning food preparations and nutrition related concerns, please visit Rainbow Children's Hospital, Marathahalli on OPD basis. Thank you.